You said that our politicians have to get involved. What must they do?
Well, the president said during the campaign that he was committed to a national AIDS strategy, and he is fulfilling that campaign promise. When the United States gives money to other countries, to fight HIV and AIDS, we require that they have a national AIDS strategy. We don't have a national AIDS strategy, in the United States. And as my grandmother used to say, when you fail to plan, you plan to fail. We have a hodgepodge of uncoordinated and often conflicting programs and activities. Hopefully, the president and his administration and the national office, the White House Office on National AIDS Policy, is working to develop a national AIDS strategy. That national AIDS strategy, should tie into public health outcomes. How do we reduce HIV rates in our communities, particularly in those communities that are most impacted by HIV? How do we increase the percentage of folks who know their HIV status? How do we increase the percentage of HIV positive folks who are in care and treatment? How do we reduce stigma? So it has to tie to those things. So the National AIDS Strategy also definitely needs to realistically look at the populations that are most impacted. So it has to address the needs of gay men, it has to address the needs of women, it has to address the needs of drug users, it has to address the needs of older Americans, it has to address the needs of the African American community and other people of color. That it needs to set out clear, measurable goals and objectives of what are we going to do in this year to move the ball down the field towards the end of the AIDS epidemic. I think that those conversations are currently going on.
But are you involved in those?
We definitely are involved in those kinds of conversations. The Black AIDS Institute has been an advocate for a national AIDS strategy for 2 years already. We are involved regularly in communicating with the administration, but most importantly, we're involved in engaging Black folks in the process. And in my opinion, the only way that a national AIDS strategy is going to be effective in America is for that plan to be developed in collaboration with Black institutions in America. And so we are involved in getting those institutions involved.
Like on your website, you have a list of 50 organizations that are helping those with HIV and AIDS. They're doing some kind of HIV and AIDS work in these United States. What should there be? Should there be a body, a head organization that we're saying that the United States should have it, that the president should have that our laws should possess that? But should the Black AIDS Institute be the body of those smaller organizations? Should there be a point of view that runs through all of these organizations?
Absolutely not.
No.
Okay. Because nobody has the crystal ball. And it's not. America is great because we have the ability to, and have had the ability to bring different points of view together. Quite frankly, I think that many of our challenges of late are the result of this emphasis on groupthink. That in the previous administration, there was this narrow definition of what politics made you American. So if you were not conservative, you weren't American. If you didn't believe in the nuclear family, you were not American. If you were not Christian, you were not American. If you were not for the war in Iraq, the war in Afghanistan, you weren't American. Somehow, supporting our troops meant sending more and more and more of our young men and women to be cannon fodder. And if you didn't believe in that, you were not American. If you're and so I think that quite frankly is antithetical to what has made America great. What has made America great is the fact that we have had the privilege of there being different points of view, and all of those points of view, you know, were a part of what it meant to be American.
Right.
You know, the whole notion of, you know, I may disagree with what you say, but I will fight to the death your right to say it. You know, your right to think it, the right to be it. You know, that's what makes us great. So no, I don't think that there needs to be, you know, one big think tank, one big thought.
Not a big think tank, but an organization such as yours that has been in the trenches. Mm-hmm. Somebody who has been around as you've been around, to know, to see, to think about these things intelligently. Not to say that you must do this, but to be able to sustain those that may not be as strong as you, to be able to reach out to that community in the Midwest that's flailing, you know, so that these organizations can thrive and do the work in their mission statements. Louisiana, it was very difficult. It was very difficult to go to an organization and see some of the organizations floundering. Will they always flounder? Mm-hmm. I don't know. They could get stronger. Mm-hmm. But my question was not for all of us to think alike, but that there is this body that says, yeah, we're after the same goals, and we're going to do everything in our power, either through speech, through communication, through more money, to help you thrive, so that the incidence of HIV and AIDS lessens.
Right. Certainly, you know, we need to always strive to be smarter and better and more effective and more efficient. And certainly at the Black AIDS Institute, you know, one of the things that we try to do every day is to, you know, improve and build upon the infrastructure in Black America to respond to the AIDS epidemic, to expand the capacity of Black America to respond to the AIDS epidemic. And certainly, you know, one of the things that we do is training and capacity building. You know, every single day we train people to be better at delivering HIV services and messages. You know, and when we work in rural Louisiana or rural Mississippi, you know, or rural Georgia or rural Alabama, you know, one of the things that we don't do is we do not go in and presuppose that we have all the answers. You know, what we attempt to do is to take our experience and marry it to, you know, their reality, and to see if we can support them in ways that they feel they need assistance. But we are definitely the supporters, that they are the leaders, you know. And as Calvin Rolock said, nobody can save us from us but us. You know, so if you need to be saved, I can lend you a hand, but you have to be, you know, the leader, you know, of your salvation.